Dapat po munang alamin or matukoy ang pangunahing problema ng bansa upang mapagtuunan ng pansin at mabigyan ng solusyon.
We should have specific goals, do research, and make a policy that is fair for everyone.
Walang problema sa pulisiya. Iayos lang ang pagpapatupad.
Bago patubas ang batas, pag-aralan muna gusto ng government.
Two things, clarity and execution. Both, you need the communication and monitoring. As simple as that.
Mandato ng Philippine Institute for Development Studies o PIDS na gumawa ng mga pag-aaral at pananaliksik ng mga polisiya at programa ng pamahalaan at magbigay ng rekomendasyon sa mga mambabatas sa pagbabalangkas ng mga polisiyang makakatulong sa ating bansa. Sinusulong ng aming ahensya ang evidence-based policy making upang bigyan din ng kahalagahan ng polisiya na batay sa datos at policy research na sumusuri sa tunay na kalagayan ng ating mga komunidad. Napakahalaga ng policy research, lalo na sa mga panahong dumadaan sa krisis ang ating bansa.
Kapag pulisiya ay pinag-aralan, susulong ang bayan!
In need of references for your research? Do you want a digital library that you can access for free anytime and anywhere? You don't have to look far. SERPI is here for you. SERPI is an online database of socioeconomic materials produced by the Philippine Institute for Development Studies. Government agencies, research and academic institutions, and international organizations based in the Philippines. It is the country's first online repository of socioeconomic information, created for policymakers and development practitioners, researchers, educators, and students. To access SERPI, just visit the PIDS website and click the SERPI widget under the Databases tab, or type serp-p.pids.gov.ph. SERPI has a wide variety of materials such as journal articles, books, research papers, working papers, policy notes, audiovisual materials, and more. As of 2022, SERPI has more than 60 partner institutions contributing knowledge resources to the database. SERPI provides a comprehensive coverage of references encompassing 22 research themes: labor and education, gender and development, poverty, technology and innovation, trade and industry, and many more. On the enhanced website of SERPI, you can filter your research by keyword or author, publication type, research theme, or year published, all at the same time. SERPI has more than 7,000 publications and audiovisual materials that you can access and download for free. What are you waiting for? Visit SERPI now. Socioeconomic Research Portal for the Philippines, innovating knowledge exchange and policy research.
So what is PIDS? For over 40 years, the Philippine Institute for Development Studies, or PIDS, has been the country's foremost socio-economic think tank. It conducts rigorous and objective policy research and analyses that help the government in crafting relevant policies, plans, and programs in support of the country's long-term vision and development goals. PIDS pursues its mandate through three basic programs: research, dissemination, and outreach. Through its research program, PIDS identifies and prioritizes studies, develops proposals, and conducts research on priority areas. The results of these studies are then disseminated through different platforms, publications, online resources, PIDS Corner, seminars, and the Development Policy Research Month, or DPRM, held every September. To shed light on key policy issues, the advice and expertise of the Institute's research fellows are also sought by policymakers, government agencies, private sector, and civil society. Since 1977, PIDS has completed numerous policy studies on a wide range of development topics. This brand of service has then translated to policies and programs that have improved the lives of every Filipino. Philippine Institute for Development Studies, service through policy research.
Dapat po munang alamin or matukoy ang pangunahing problema ng bansa upang mapagtuunan ng pansin at mabigyan ng solusyon.
We should have specific goals, do research, and make a policy that is fair for everyone.
Walang problema sa pulisiya. Iayos lang ang pagpapatupad.
Bago patubas ang batas, pag-aralan muna gusto ng government.
Two things, clarity and execution. Both, you need the communication and monitoring. As simple as that.
Mandato ng Philippine Institute for Development Studies o PIDS na gumawa ng mga pag-aaral at pananaliksik ng mga polisiya at programa ng pamalaan at magbigay ng rekomendasyon sa mga mambabatas sa pagbabalangkas ng mga polisiyang makakatulong sa ating bansa. Sinusulong ng aming ahensya ang evidence-based policy making upang bigyan diin ng kahalagahan ng polisiya na batay sa datos at policy research na sumusuri sa tunay na kalagayan ng ating mga komunidad. Napakahalaga ng policy research, lalo na sa mga panahong dumadaan sa krisis ang ating bansa.
Kapag pulisiya ay pinag-aralan, susulong ang bayan.
In need of references for your research? Do you want a digital library that you can access for free anytime and anywhere? You don't have to look far. SERPI is here for you. SERPI is an online database of socioeconomic materials produced by the Philippine Institute for Development Studies. Government agencies, research and academic institutions, and international organizations based in the Philippines. It is the country's first online repository of socioeconomic information, created for policymakers and development practitioners, researchers, educators, and students. To access SERPI, just visit the PIDS website and click the SERPI widget under the Databases tab, or type serp-p.pids.gov.ph. SERPI has a wide variety of materials such as journal articles, books, research papers, working papers, policy notes, audiovisual materials, and more. As of 2022, SERPI has more than 60 partner institutions contributing knowledge resources to the database. SERPI provides a comprehensive coverage of references encompassing 22 research themes: labor and education, gender and development, poverty, technology and innovation, trade and industry, and many more. On the enhanced website of SERPI, you can filter your research by keyword or author, publication type, research theme, or year published, all at the same time. SERPI has more than 7,000 publications and audiovisual materials that you can access and download for free. What are you waiting for? Visit SERPI now. Socioeconomic research portal for the Philippines, innovating knowledge exchange and policy research.
So what is PIDS? For over 40 years, the Philippine Institute for Development Studies, or PIDS, has been the country's foremost socioeconomic think tank. It conducts rigorous and objective policy research and analyses that help the government in crafting relevant policies, plans, and programs in support of the country's long-term vision and development goals. PIDS pursues its mandate through three basic programs: research, dissemination, and outreach. Through its research program, PIDS identifies and prioritizes studies, develops proposals, and conducts research on priority areas. The results of these studies are then disseminated through different platforms, publications, online resources, PIDS Corner, seminars, and the Development Policy Research Month, or DPRM, held every September. To shed light on key policy issues, the advice and expertise of the Institute's research fellows are also sought by policymakers, government agencies, private sector, and civil society. Since 1977, PIDS has completed numerous policy studies on a wide range of development topics. This brand of service has then translated to policies and programs that have improved the lives of every Filipino. Philippine Institute for Development Studies, service through policy research.
Welcome to the PIDS webinar series. Before we start our virtual event, we have some reminders. For attendees, your microphone is automatically muted upon entry. If you wish to join the discussion, click the Q&A icon, type your question, and click send. For Facebook viewers, you may send your question using the comment section. Remember to keep your questions concise and direct to the point. We will screen all questions to ensure that they are relevant to the webinar topic and the presentation. The moderator will read the questions during the open forum and cover as many as possible depending on the available time. This webinar is being recorded and live streamed on the PIDS and SERPI Facebook pages. The recording will also be made publicly available on the PIDS YouTube channel. Thank you for joining us, and we look forward to your active participation.
Okay, so good morning and welcome to another of our webinar series this month. Our webinar today is all about tracking nutrition spending and assessing early childhood care and development in the Philippines. I am Sonny Domingo and I'll be your host and moderator for this morning. This webinar is being held in observance of the National Children's Month. Today, we will examine the ability of Filipino children to access healthcare, nutrition, and education with the goal of recommending policies that will allow involved government agencies to realign expenditures for more effective intervention. Before we begin, we invite you to actively engage with us via the Q&A box of Zoom and the comment section of Facebook Live. Formally start our program, let us welcome PIDS President Dr. Aniceto Orbeta Jr. to give his opening remarks. Orbeta, please.
Thanks, Sunny. Good morning to all our participants joining us here in Zoom and those through the PIDS and SERPI Facebook pages. Before we start, I would like to greet the following esteemed officials. Department of Education Schools Division Office, Tayabas Assistant Schools Division Superintendent Herbert Perez, National Anti-Poverty Commission Youth and Student Sectoral Council Member Mark Devon Maitim, House of Representatives Committee on Welfare of Children, Committee Secretary Sylvia Chico, Department of Social Welfare and Development Assistant Secretary Ada Culico, Xavier University Assistant Principal for Administration Fritzi Rapadas, Concerned Citizens of Abra for Good Government Incorporated Vice Chairperson Aniceto Baltar, ID Insight Associate Director Mia Jong, ID Insight Manager Stephen Walker, Kasuga Integrated School President Cherilyn Kasuga. I would also like to greet the various representatives from government, academia, private sector, civil society, and media virtually present today. Thank you for joining us as we address two critical issues essential to all children's and society's future: nutrition spending, and early childhood care and development, or ECCD, in the Philippines. The early years of life are decisive in shaping a child's growth and development. The quality of nutrition, and care provided during this phase profoundly influences physical and cognitive development, affecting future health, education, and productivity. ECCD therefore serves not only as a framework for individual child development, but also as a vital investment in breaking the cycle of poverty and fostering equitable opportunities from the earliest stages of life. In recognition of this importance, the ECCD Act of 2000 established a national policy framework to address young and children's health, nutrition, education, and psychosocial needs. Despite commendable progress made by government in advancing ECCD's initiatives, significant challenges remain. A 2023 study by PIDS highlights that approximately 1/3 of Filipino children suffer from stunting or chronic malnutrition, underscoring the urgency of targeted investments. Addressing malnutrition and stunting during the critical first 1,000 days of life is essential for ensuring healthy growth, cognitive development, and long-term well-being. Unfortunately, chronic malnutrition and inadequate early education continue to limit the potential of many Filipino children. This brings us to today's featured study, Behind the Slow Start, an assessment of early childhood care and development in the Philippines, presented by PIDS Senior Research Fellow, Dr. Valerie Gilbert Ulep, and Research Specialist, Mr. Lyle Daryl Casas. This study comprehensively examines the Filipino children's health, nutrition, and early education, exploring access to essential services and identifying critical gaps in the current system. It highlights persistent challenges in governance, infrastructure, and financing, which collectively hinder the full realization of ECD's potential. One of the most urgent challenges identified in the ECD implementation is the fragmented nature of financing, which significantly impacts the effectiveness of nutrition interventions. Another PIDS study further emphasized this point, revealing that public spending on nutrition is often insufficient, fragmented, and poorly targeted. This inefficiency demands a strategic overhaul in allocating, monitoring, and utilizing funds to maximize impact. Today's discussion will also feature a complementary study tracking nutrition investments, proposed nutrition budget tagging framework, and typology of national government agencies in the Philippines, also presented by Dr. Ulep and Mr. Casas. This framework proposes a mechanism to improve resource mobilization, enhance transparency, and strengthen accountability in allocating nutrition-related funding across government agencies. Adding depth to our discussion, we are joined by ECD Council Planning Officer Karl Jeffrey Sabalza and UNICEF Philippines Nutrition Manager Alice Nkoroi, who will share valuable insights on these pressing issues. As we commemorate the National Children's Month this November, let us take this opportunity to reflect on the urgency of making effective investments in health and development of our children. The future of our nation depends on ensuring that the next generation receives the care, support, and opportunities they need to thrive. I encourage everyone to actively participate in today's discussion, as the solutions we identify will shape the lives of the future generations. Thank you, and I now turn over the floor to our moderator.
Thank you very much, Dr. Orbeta. So I think We are now ready to start the webinar proper. But before we go to our presentations, as our tradition goes, we'll have a very quick poll. And with that, please answer this question. In your opinion, what is the extent of poor health and malnutrition among Filipino children? Okay, I'll repeat the question. In your opinion, what is the extent of poor health and malnutrition among Filipino children? Choices are not extensive, moderate, extensive, or very extensive. So just choose one answer. Again, I'll repeat the poll question. What is the extent of poor health and malnutrition among Filipino children? Not extensive, moderate, extensive, very extensive. So for those joining us via Zoom, click on the link provided in the chat box. And for those joining us via Facebook Live, use the comment section. We'll give you a few more seconds to log your answers before we show the graph. We are now being joined by more than 100 participants via Zoom and Facebook Live. Okay, so with the question, what is the extent of poor health and malnutrition among Filipino children? You've answered extensive. And a good number also answered very extensive. So this is a very interesting result. And our resource speakers later on will give more clarity to this concern. And I guess the numbers also show a good room for possible intervention, not only from government, but also from our partners outside. Okay, so let's now proceed with our presentations. As mentioned by Dr. Orbeta, we have two PIDS studies to be presented this morning. The first presentation is about the PIDS study titled Behind the Slow Start, an Assessment of Early Childhood Care and Development in the Philippines, authored by PIDS Senior Research Fellow Valerie Gilbert Ulep, Research Specialist Lyle Daryl Casas, Project Technical Specialist Aaron Carlos Manuel, and Research Analyst John Paulo Mendoza, with PIDS consultants Joy Bagas, Kim Leonard De La Luna, and others. It analyzes health, nutrition, and early education outcomes of Filipino children. Study accounts for their access to essential services in these aspects, as well as conditions in governance, financing, infrastructure, human resources, to identify the factors that hinder the accessibility of these services and make appropriate policy recommendations to enable timely interventions in ECCD. The second presentation is based on another PIDS study titled Tracking Nutrition Investments, Proposed Nutrition Budget Tagging Framework and Typology for the National Government Agencies in the Philippines, also authored by Dr. Ulep, Mr. Casas, and Mr. Bagas. It categorizes national government expenditures on nutrition based on intervention level and malnutrition risk. The study presents this framework as a tool to evaluate the efficacy of public spending on nutrition and to align with other government programs like the Philippine Plan of Action for Nutrition, or PPAN. To discuss both studies, we have Dr. Ulep and Mr. Casas with us. So allow me to give a better introduction of our speakers. Dr. Ulep, or Dr. Valerie Gilbert T. Ulep, is a senior research fellow at PIDS and also a senior researcher at the Ateneo School of Government. He previously led the Philippine Health Facility Development Plan 2020-2040 for the Department of Health and Asian Development Bank. Dr. Ulep has experience with the World Bank in Washington, D.C. and Delhi, focusing on South Asia. A PhD in health economics, he has consulted with WHO, ADB, USAID, and received honors, including the Nikkei Asia Award, and Emerging Voices for Global Health. Meanwhile, our other speaker, Sir Lyle Daryl Casas, is a research specialist at the Philippine Institute for Development Studies. Prior to his joining the PIDS, he was Science Research Specialist at the Food and Nutrition Research Institute, or FNRI, involved in the nationwide data collection for the expanded National Nutrition Survey. He is currently involved in the PIDS research studies on UHC reforms, including health financing, early childhood care and education, and child nutrition. His published work includes peer-reviewed research articles and discussion papers on nutrition, public health systems, and health policy. He holds a bachelor's degree in nutrition and dietetics and is currently finishing his Master of Public Health with a concentration in epidemiology at the University of the Philippines, Manila. Thank you for joining us today, Dr. Val, Mr. Lyle. You may now begin your presentation.
Thank you, Sunny. So, okay. We're going to present first the study on early childhood care and development. Okay, so thank you very much again for joining us at PIDS. So I'm going to first present our paper on the assessment of early childhood care and development in the Philippines. So I just want to mention that this paper was made possible because of my co-authors, so Lyle, Aaron, Paolo, Joy, and Kim of UP Manila. So this is a very long report. Actually, it's an around 80-page report. So I think it's really hard to condense all the different findings of these study, but we were able to condense the multiple finding into around 30 slides, right? So this paper was in partnership with the Education Commission of the Philippine Congress to guide them in path-breaking education reforms, right? So we believe that education and health are intertwined and they go together. So it's important for us to analyze both of them at the same time. Okay, next slide. So this will be the outline of my presentation. So I'll be talking first with the outcomes, right? So when I say outcomes, these are your health and early education outcomes, right? These are your tangible indicators, right? The second is we will look into output. So what explains the poor the poor outcomes in the country? So most of these are access indicators, so issues related to health, nutrition, and early education services, right? Then we look into input. So what explains the poor access to these critical and essential services? So this could be an issue of financing. So are we do we have enough resources, for example, or are we financing the right interventions, right? So we are going to tackle also human resources. Do we have enough human resources to provide these services, right? Or are of the high quality? The second is governance and organizational structure of our institutions that provides the services, right? And the last one is service delivery, infrastructure, and capital investment. So do we have enough infrastructure to deliver these services, right? And the last one will be ways forward or recommendations for the government. Next slide. So this is our assessment framework for us to better organize and diagnose the problem of early childhood care in the Philippines. So I will start with the left, with the right section of this framework, which is improve outcomes. Again, these are your health and education outcomes. And health and education outcome is a function of access and participation, and obviously the quality of services that we provide to children and mother, for instance, right? So, and access and participation is a function of two important aspects: supply, right? So supply means your capital investments, your primary care facilities, your daycare centers, right? Another one is adequacy and quality of your healthcare workers or education workers, right? Do we have enough of them, right? And second is financing, right? So do we have enough resources? And part of that is your policy landscape, your institutions, right? That provides these services. Then the last and another important domain is parental demand, like what are the practices of parents, right, or caregivers, right? So all these factors is part of that ecosystem that determines your outcomes at the end of the day, right? So I think this framework will help us better organize and diagnose the problem of early childhood care in the Philippines. So next slide. Okay, I'll start with the left section, which is the scale of the problem of poor health and nutrition and early education outcomes. In the paper, this is a very long discussion describing the scale of the problem. We try to benchmark our health status and education status in the Philippines, but I will not go through them because we've written a lot of these benchmarking exercises in PIDS. So if you want to know more about the current state of poor health and nutrition in the Philippines, we've written maybe like 3 or 5 documents on this, but I'll try to highlight the gist of this section, which is to describe the scale of the problem. Gaano ba kalaki yung problema natin when it comes to child health, no? Okay, next slide. I'll start with child health, no? And one of the important indicators of child health is called infant mortality rate. So how many children are so when we say infant mortality, how many infants are how many infants experience death, no? Experience death, no? And what we've seen in the Philippines, that in every 1,000 babies born, there are around 21 die before the age of 1 and around 27 before the age of 5, no? If you compare this to other countries, we are relatively at the higher tier, no? So, and if you look at our historical data, around the decline is around 1% compared to around 3 to 5% in many ASEAN countries, no? And when we try to disaggregate infant mortality rate in across regions in the Philippines, you will see large variation in infant mortality. So the left figure will show you that huge disparity. So there are parts of the country, like for instance, ARM, and lots of poorer regions in the country. If you look at their infant mortality rate, it's actually comparable to the poorest countries in the world, right? So if you look at ARM, for instance, their infant mortality is actually lower than the average for poorer regions in the world, right? Like for instance, sub-Saharan Africa. So andun yung level nila. And when you go to other parts of the country, like NCR or Region 4A, their infant mortality rate is actually comparable to many emerging economies. So what we're seeing here is that the health outcomes of the Philippines, or child health outcomes in the Philippines, is a microcosm of global inequities, right? So there are high-performing, there are poor-performing countries, which is very interesting, no? It's a microcosm of global inequities, right? So if you look at the disparity across socioeconomic status, you will see large variation. The poorest households have 5 times worse outcomes than their wealthiest counterparts. You don't see this in many countries in the region, like Thailand or Malaysia, or even Vietnam. You don't see that huge variation in infant mortality. Next slide. Okay, so another important indicator of child outcomes is stunting, which is a manifestation of chronic malnutrition. So in the Philippines, even the children survive, 1 in every 3 is chronically malnourished. So that's approximately 4 million Filipino children. So 4 million Filipino children are chronically malnourished. So when we try to look at historical data, the decline in infant mortality rate in the Philippines is very slow, around 1%, 1% annually, right? If you compare it to other regional peers and high-performing countries, they experience around 5 to 6% in the last 30 years. We've written a lot of this in PIDS. No? So when we try to benchmark our country in terms of decline in in stunting, you will see a plateauing levels of stunting in the Philippines. So you can see that in the right figure, right? So the red figure, you will see plateauing levels of stunting prevalence. And if you compare it with other countries like high-performing countries like Peru, Bangladesh, or Vietnam, you will see large decline. And if you look into the interventions that these countries have done, you will be amazed now. So we see that slow decline in stunting rates in the Philippines. And we've written a lot of this in PIDS. So if you want to learn more about these the stunting problems in the Philippines, we have a separate report on this. But again, we just want to highlight these very important problem on chronic malnutrition. Next slide. Okay, in the paper, we also discuss or try to explain the problems of early education, or education outcomes in the Philippines, or the challenges in terms of education outcomes in the Philippines. And PIDS have also written a lot about this. So in the report, we've mentioned that 9 out of 10 children aged 10 cannot read proficiently. But in the report, we also try to understand that disparity of cognitive challenges amongst Filipino children. And what you've seen is the large variation in cognitive scores, for instance, for the poorest and the lowest. Again, it's not just the low average, like the low average, relatively low average, but the large disparity, to me, is more alarming, right? Okay, so next slide. So after discussing the challenges in terms of outcomes, education, nutrition, and health outcomes, we begin to ask ourselves, why do we have poor health, nutrition, and early education outcomes? And here, what we argue is that these poor outcome is a manifestation of poor access to basic services. Again, in the report, we try to elaborate this now, but I think we will just identify key areas. So number 1, next slide. Okay, and our argument is that for us to see improvement in early education, education, nutrition, and health, we need to look at the provision of services as a journey. So services should be provided at different life stages: in pregnancy, in infant stage, in toddler stage, preschool stage, and childhood. There is no single intervention that could be used to address health and nutrition challenges in the Philippines. There is no shortcut. We need to provide this range of intervention at critical period, from pregnancy to childhood. And what we are seeing is that there are challenges in every stage, and we will try to explain and identify some indicators that explain why we have challenges at different life stages, right? So next slide. I'll start with pregnancy, right? I'll start with pregnancy because if you look at empirical studies, the experience of the child in the womb is an important determinant, right, of adult health, right? So here we try to explain that a lot of children, even at the fetal stage, are already experiencing stress, right? So I'll start with the current state of malnutrition in women, right? So approximately around 14% of Filipino women of reproductive age are underweight. And this increases to around 20% among young adolescents. No? So imagine that a lot of women are a lot of potential mothers are chronically malnourished, right? They are malnourished. And if they are malnourished, that increases the stress increases the exposure of the child to different fetal stresses, right? And the problem in the Philippines is that the high level of chronic malnutrition among women is also coincides with the propensity of them being pregnant, right? So they are chronically malnourished, and at the same time they are pregnant, right? So that is the main challenge in the Philippines. So if you look at access to contraceptives, for instance, it is actually very low among young adolescents, right? So when the mother is already pregnant, you will also have issues when it comes to access to prenatal care during first trimester, issues related to macronutrient supplementation and poor access to postnatal care, right? So at that stage, you already have challenges, when the mother is pregnant. Next slide. Okay, so another important indicator that we also examine in the paper is the provision of essential health services. And in this case, we try to look at DP3 vaccination coverage, right? We want to emphasize this, that the most basic services that a country should provide is vaccination. If your child vaccination is crappy, don't expect your other services to be actually good, right? And in the Philippines, only 75% of Filipino children are fully immunized. Again, we have a paper on this looking into fully immunized children in the Philippines. And we haven't really reached the 95% recommended in the last 30 years. So this is very alarming in my view, no? And if you try to look at the disaggregation of vaccination coverage, you will see large variation, right? Again, in ARM, it's actually less than 20% of our children in ARM are not immunized by DP3 vaccination. No? So this is very alarming. When you try to compare that with other countries, it's actually much lower than Somalia, which is a fragile state, right? Again, I keep emphasizing not to look at solely on the average, but the large variation. And I think that's what we are failing, that huge variation in terms of provision of services. No? There are parts of the country that would have almost 90 to 100% coverage, and there are countries with less than 20%. And it's a shame, if you ask me, because again, vaccination is the most essential services that you could actually provide. No? So yeah, that's for essential health services in the form of vaccination. Next slide. Okay, we also try to examine access to wash facilities, because access to wash is a very important determinant of infection, right? On average, again, in the Philippines, you will have high level of access to wash facilities, but there are municipalities in the Philippines that have high exposure to open defecation, right? And some of these municipalities are around, the prevalence is around 50%. No? So again, if you have high level of exposure to open, if you have high level of open defecation, the propensity of the child to experience infection or disease is higher. And if the child is always sick because of infection, then that also contributes to chronic malnutrition. No, it's not all about nutrition or the food, but also the propensity of the child to become ill, right? So okay, next slide. Another important aspect that we've discussed in the paper is access to high quality high quality food. And we try to examine the prevalence of children with the recommended energy intake. And what we observe is that only 20% of children in the Philippines have reached the recommended energy intake. And again, there is high variation. There are, if you look at the poorest, it's actually less than 20%. No, and what is interesting here is that even the top 20% are not meeting the recommended energy intake, which to me needs further examination. Why even our richest children are not meeting the recommended energy intake? So this data was analyzed using the National Nutrition Survey. No? Then we also tried to examine the composition of food that they are eating. No? And what we are seeing is that there is variation. No? Among the poor, they are more likely to eat carbohydrates. The rich are more likely to eat protein. And protein is a very important determinant of chronic malnutrition, right? So again, we have issues in terms of quantity, and we have issues when it comes to quality and diversity of food, which is an important determinant of chronic malnutrition. Next slide. Okay, another important aspect that we discuss in the paper is access to government feeding programs. I think this is a very big part of the report because if you look at our resources, public resources in addressing chronic malnutrition, we have substantial, our budget towards these programs is very substantial, right? So we try to examine access to feeding programs, government feeding programs. And what we are seeing is that only 20% of our poor children have received government feeding programs. And what we try to do here is examine whether there is variation in coverage across age. And what we've noticed is that it's even lower among 0 to 2, or the first 1,000 days of life, meaning only 20% of our children age 0 to 2 are receiving government feeding program. And again, I keep emphasizing that the first 1,000 days, or the age 0 to 2, are the most critical period of a child's life. No? And yeah, so we only have 20% receiving government feeding programs, right? And we try to examine the coverage rate among children receiving government programs in daycare centers. So I think, if I'm not mistaken, there is a law that suggests or stipulates that all children in daycare centers should be receiving feeding programs, right? But in our analysis, only 35% of these children attending daycare center aged 3 to 6 are receiving government feeding programs. So again, there is poor coverage when it comes to feeding programs in daycare centers, even though that is mandated by the law. Next slide. Okay, another important part of the paper is to look into the impact of government feeding programs. So do we see improvements in nutrition outcomes amongst children receiving government feeding programs? So we perform a propensity score matching, which is a statistical method to see the impact of government feeding programs on mean energy intake. Nag-increase ba yung mean energy intake of those children receiving government programs? And nag-increase ba yung protein intake nila? And what we observe is that there is no difference. There is no statistical difference of those children receiving government feeding program and those who did not receive government feeding programs. So again, this provides insights to whether our feeding programs are making difference when it comes to nutrition. I understand that there are other outcomes like concentration, things like that. But when it comes to improving energy intake or protein intake, we don't see any statistical significance. Next slide. We also examine stimulation in the paper, and what we see is that only half of children in poor household engage in early stimulation. And that's very high now. So early stimulation is an important determinant of good performance in early education. So again, only 50% of them, of the poor children have received reading materials or watching education materials now. So only 50%. Next slide. Okay, we also examine attendance to early education. Here, it's pre-K among children age 3 to 4, right? So, and what we've examined, what we've noticed is that only 20% of children in 2022 are attending pre-kindergarten programs. So these are children age 3 to 4, no? So pre-kindergarten. So during the pandemic, before the pandemic, the coverage is around 40%, but after the pandemic, and during the pandemic it declined, but in 2022 it increased to 20%, but it hasn't reached the pre-pandemic level of 40% now. Again, there is also large variation across regions. In BARM, the enrollment among children 3 to 5 is less than 5%. In other parts of the country is around 40%. There is also large market segmentation. Meaning that the richer segments of the population, they go to private early education facilities. Poorer children are more likely to go to public, which is expected. Next slide. Okay, so those are your access indicators, right? Now we look into input. So what are the challenges when it comes to input? So next slide. So these are the domains under inputs. So financing low public spending, current investments poured into less cost-effective interventions. Second is governance, fragmented governance and organizational structure. Third is lacking of human resources. Fourth, inequity in capital investments. Next slide. Okay, so I'll start with governance structure. So if you look at government documents, I think multi-sectoral collaboration is one of the mostly used words to describe the organizational structure in addressing nutrition in the Philippines. But we try to examine the challenges when it comes to multi-sectoral collaboration. So number one is we've noticed difficulties in implementing accountabilities among key line agencies. Explaining the co-equal nature of government department complicates program alignments. So that's one of the challenges in terms of multi-sectoral collaboration. Another one is the limited capacity of multi-sectoral institution despite high expectation. So what we're trying to say here is we rely so much on our multi-sectoral secretariats to deliver, finance these critical services. But when you look at the capacity, the technical administrative capacities of these secretariats are actually very limited, right? Another important aspect that we've described is the challenges in vertical governance, meaning from the national to local, right? So there is disconnect in that front, insufficient training and guidance for local implementation of ECCD standards. Like local governments often lack resources to implement standards effectively, and central set standards often fail to adapt to local context, resulting to unattained objectives. Next slide. In the paper, we try to elaborate this through a case study. And what you've seen is one, so what we try to examine one high-performing local governments that institutionalize ECCD programs. And what you've seen in these in this local government is that there is very systematic and institutionalized system to provide early childhood care programs. You will see a very systematic and multiple funding streams in financing ECCD services at different levels of the government. And we also examine another local governments that you will see challenges when it comes to governance structure in the implementation of early childhood care. So you will see limited funding poured into ECCD, and most of these local governments are highly dependent on volunteers. So there is no continuity. It's volunteer driven. Investments in early childhood care in these cases are dependent on local government local chief executive. Again, there is no institutionalization because it's personality dependent rather than institution based, right? When it comes to provision of the organizational structure and inadequate infrastructure, right? So again, as a function of poor investments, right? Next slide. So we also tried to look at the quantity of our daycare or childhood development workers, which is very important, right? So if I'm not mistaken, the standard is that there is one development worker per for every 10 children enrolled in daycare centers. And what we've seen is possible overcrowding, right? So despite the low coverage at the national level, if you look at those who are attending relative to the number of teachers in daycare centers, we think that there is overcrowding, right? So the average is there is one daycare children for every 18 children, which is higher than the proposed standards, no? And this is higher in highly urbanized city, which is expected because of the high number of population in highly urbanized cities. No? So we try to map out the ratio across municipalities in the Philippines, and you will see large variation. Again, you can see that in your right figure, which is the map. So we try to map the ratio across municipalities in the country, and you will see variation. Again, it's a manifestation that local governments have different priorities when it comes to this. Now, next slide. We also try to look at capital investment. So do we have enough daycare centers in the Philippines? And you will see here, again, huge variation. You will see huge variation. And we observe socioeconomic gradient. So in municipalities that are relatively poorer, you will see lower ratio. So that is just the point of this slide. And we try to map or create a map showing that ratio across municipalities. And again, huge variation when it comes to capital investments. And in this case, the number of daycare centers or child development centers. Next slide. So we also try to examine, we try to scan the market, meaning of child development, of daycare centers. So who are providing early childhood care in the Philippines? And what we've seen is around 99% of our early education facilities are publicly owned, and around only 1% are private. We try to examine multiple data because the government doesn't really have a complete number of private facilities that provide early educations. We try to triangulate multiple sources, but still our guess is it's actually less than, I mean, it's around 1%, no, private, no. And we begin to hypothesize why the private is not reacting to, is there no demand for early education? That's why we see like low levels of public facilities providing early childhood care. So again, this is important when we try to expand early education and begin to ask what is the role of the private sector when it comes to provision of early education. But given this supply level, what can the government do to address this? No, next slide. So here we also try to project, we try to project the needed capital investments for early education relative to our population. And the tag price of this is very expensive, right? But again, we need to mention this, that the country needs to make these investments. No, so here we just provide the needed number of daycare centers and child development centers until 2050. Next slide. Okay, so I'm now in my last section of this document of the report now. So we have the following recommendation. This is actually a very long part of the report because we want it to be detailed as much as possible and more operationable when it comes to providing recommendation. So in the report, we talk a lot about, we discuss a lot, we discuss models or innovative financing models that the country could provide, like rolling out and piloting PP models like voucher systems and block grants to improve early education and participation and assess their impact on access and supply growth before large-scale implementation. Because what we've seen is that there is no demand, right? Or there's limited demand, right? So innovative financing models could actually address this, address both demand and a possible impact on the supply. So maybe implementing or rolling out PPP models like voucher and block grants could improve this. There are models implemented in other countries that the Philippines could really examine and implement now. Another important recommendation that we've raised is investing in science-based behavior change communication, targeting diverse socio-demographic groups across various media platforms. This involves community engagement, continuous monitoring, and collaboration with institutions to develop comprehensive plans for effective audience and engagement. Because I think the issue here is the low demand for early education, and there are misconceptions about early education. So the country needs to invest in science-based behavior change communication to address this, to address that demand issues. Next slide. Another important recommendation in the report is the leveraging national resources. What we've seen is that the main driver of the low spending of local government and the increasing national resources towards early education must be rationalized, meaning that we could use our national resources to influence local government spending, not to substitute it, right? So how can we use our existing national resources to push local government to spend more? But what's really happening, and this is also true in health, is that the national resources is increasing, but the local government spending is decreasing. And you don't want that in a decentralized regime, right? You want your national resources as a driver to spend for local government to spend more, not the other way around, right? So we try to elaborate this on how we can use our national resources so that local government could spend more. We have discussed matching grants, for instance, or how do we allocate better our resources strategically to to poorer local governments, right? And how to be more equitable and more efficient when it comes to resource allocation, rather than spreading ourselves too thinly parang what is the mechanism for us to better and efficiently allocate national resources, right? Another important part of the discussion or the recommendation is the implementation of the Universal Healthcare Act. Our argument is for us to fully deliver the range of intervention from pregnancy until the age of 5 is through existing mechanism such as primary healthcare, and primary healthcare is already embedded in the Universal Healthcare Act, right? As I've said, for us to see the outcomes, we need to deliver that set of health and nutrition services at in a continuous, comprehensive manner. And through the Universal Healthcare Act and primary healthcare, you can actually deliver that, right? There is no, we believe that sporadic or individual, how do I say it, sporadic and supplementary type of provision of services will not address that level of provision or that comprehensive provision of services. There needs to be a more systematic, continuous provision of services through primary healthcare systems, no, rather than very sporadic, supplementary type of intervention, no, which to us might be less effective. Okay, next slide. Another important recommendation is actually reevaluating school feeding programs, right? There needs to be a comprehensive assessment of our feeding programs. No, why don't we see impact when it comes to improvement in nutrition outcomes? Are there issues when it comes to fidelity of implementation? Do we have, are the benefits provided adequate to begin with? Maybe we are not, we are providing, but they're not adequate, right? And we also need to examine the behavior of parents when it comes to feeding programs. Like, so that might have, through that, you could explain why don't we see impact of feeding programs. There might be dynamics within households that we do not understand when the child is exposed to feeding programs. They might be eating less in school, in households when the child is exposed to feeding programs, things like that. So we need to understand the dynamics between the child and the parent, no, or the caregiver. So our recommendation is to really target resource allocation, right? Because of meager resources, you want to start the provision of feeding programs to areas that needs the most, right? So rather than spreading your resources indiscriminately or indiscriminately, so you might need to explore that idea. Because if you have a meager resources and you're spreading yourself too thinly, you don't see marginal improvements in your outcomes. Next slide. Another important recommendation is addressing governance challenges. Like, how do we strengthen our multi-sectoral secretariats, right? How do we make sure that our multi-sectoral secretariats are not just there to do administrative work or just doing minutes of the meeting, right? These multi-secretarial secretariats should do more technical work, should do more thinking work. And how do we improve that, right? So how do we improve their capacity to do wide range of technical and technical monitoring and evaluation type of function, right? And do more strategic direction function, right? So, and how do we do that? So how do we strengthen that, right? How do we improve staffing of these multi-sectoral secretariats? How do we develop a better organizational structure so that they can retain highly competent staff to bolster the capacity of these secretariats, right? Next slide. I think that's my last slide. So thank you very much. Over to you, Sunny.
All right. Thank you, Val. I guess we now go to your second study. May I request Lyle to start your presentation, please?
Hi, everyone. Good morning. So for this presentation now, I'll be presenting the PIDS UNICEF project, the Tracking Nutrition Investments, a guidance note for the national government agencies in the Philippines. So let me just check. I think this is not the latest slide. Okay. So first, this project was first conducted in partnership with UNICEF, and this emanated from a previous PIDS discussion paper on public expenditure review for nutrition. So I acknowledge the presence of my co-authors, Ms. Joy Bagas, Dr. Val Ulep, who is present here today. So this presentation will be very brief as it veers away from the usual format, given that it proposes a method or framework on tracking nutrition investments for the national government agencies. So the presentation will discuss 6 main parts, including the rationale, methodology, the proposed framework and typology, a sample use case, proposed budget tagging process, and the limitations and recommendations. So first, to provide a rationale for the NBT. So we know that adequate and efficient public spending is vital in addressing the long-standing problem of malnutrition in the Philippines. And long before, there is no institutionalized system in place to monitor health and nutrition spending, and critical policy questions are often left unanswered. These include if we have the adequacy of public spending on nutrition and the efficiency of spending, that is, if our resources are strategically allocated to the cost-effective intervention. So a systematic and efficient tracking system is needed to obtain regular, reliable data on nutrition spending. And this system enables decision-making to prioritize and allocate resources and promote transparency and accountability among the implementing government agencies. Next slide, please. So our current public financial system does not allow a systematic and easy way to track the nutrition expenditures both in the local and in the national level. So this means that there is no standardized system of reporting nutrition expenditures, and previously conducted expenditure reviews relied on post hoc secondary analysis of public financial data, which could be very tedious and time-consuming. So in addition to these technical issues, the government agencies implementing programs that may have an impact to nutrition are unaware, and their accountability is not clear. So this could affect the reviews, as there may be programs that could not be captured. Next slide, please. So what is the value of having this NBT in the Philippines? So this provides a systematic process in tracking the expenditures across the national government agencies, and this will be used to tag the nutrition line item expenditure. So this typology was designed to align with the PPAN, or the Philippine Plan of Action for Nutrition, with the reform actions such as the universal healthcare and multi-sectoral and life force approaches to health and nutrition. So next slide, please. Briefly, we will describe the methodology for crafting the NBT framework and typology. So the process is presented here in this slide, but I will not describe in detail, because this is just the description of the whole process that we did in coming up with the framework. So first, of course, our review of related literature, including the budget tagging guidance note from other countries. Second is the consultations with stakeholders, for instance, UNICEF and NNC. And third, based on these initial consultations, we reviewed the other literature, the NBT framework, and full typology on the reference list for the tags and codes for the budget expenditure line item that was crafted, which will be presented in detail later. And fourth, this framework, along with the full typology, was validated with select government agencies to ensure the appropriateness and the sufficiency of the typology framework and the line items listed. So fifth, this also, the topology was pre-tested with existing documents submitted by the national government agency. And lastly, this topology was revised and finalized based on the issues encountered from the pre-testing phase. So more typology items were added to cover for other possible line item expenditure. Next slide, please. Okay, so in this slide, we just briefly describe that these different agencies, the Philippine national government agencies, have various roles in nutrition, right? So these are their main mandates and their sample programs that we are expecting to have a contribution in the nutrition spending in the national level. Next slide, please. Okay, so in the next few slides, we'll be presenting the NBT framework and typology to be used in the nutrition budget tag. Next slide. Okay, so the NBT framework illustrates the classification levels of the typology crafted based on the guiding frameworks, literature, financial documents, and validation sessions from the national government agencies. So it comprises 5 levels of classification elements with 3 additional markers to group and tag the nutrition relevant line item expenditures according to these different domains. So briefly, I will run through each classification level. So first, we have the major intervention classification, which are the nutrition specific or direct and the nutrition sensitive or indirect. So direct interventions, as described by Buta et al. In 2020, are nutrition interventions that addresses the immediate determinants of malnutrition, while the indirect interventions are those interventions that addresses the underlying or enabling determinants for malnutrition. So each expenditure by a certain national government agency will be tagged if their expenditure is first direct or indirect. And then after that, that expenditure will further be tagged if depending on the nature or the program domain that expenditure will fall under. So for example, based on our guiding frameworks and review of relevant literature, here listed in this slide are the program domains that one nutrition expenditure could be classified on. So first we have here, for example, micronutrient supplementation under direct, IYCF, and then under indirect we have adolescent health and development, oral health, family planning, WASH, and other program domains. So after tagging on which program domain that expenditure will fall under, we will now tag them depending on their program component classification. So this classification level is to categorize the nutrition investments according to the type or the nature of the activity. So this includes either policy and governance, research and surveillance, human resource and capacity building, advocacy and promotion, and service delivery. So, and then after that level, we now go to the specific intervention. So these are the coded line items of specific interventions or PAPs under the first 3 levels of classification. So this will be the basis for the tagging of the line item expenditures. And then after that, we have here other markers, including the determinants or risk factors of malnutrition marker, the nutrition intervention focus area marker, which are health and nutrition, knowledge building, food production, social protection, and what. And then population demographic group marker, which corresponds to the age and if that specific expenditure is or contributes to activities for the women of reproductive age. Next slide, please. Okay, so just to show briefly that there is this identified coding diagram for each expenditure line item that corresponds to the classification levels that I have described earlier. So next slide, please. Okay, so just to provide a brief picture of what of how the typology looks like. So here, as mentioned earlier, there are specific interventions list for each of the major intervention level and major program domain. And here, the codes are pre-identified for the assigned persons to tag the expenditure line item. So for example, if there is an expenditure on the say procurement of vitamin A capsules, I mean for commodities, so this will eventually be tagged as this code, and then it's tagged to be under nutrition specific, micronutrient supplementation, and under service delivery. Next slide, please. Okay, so we all know that in the national level, not 100% of that spending amount could be attributed fully to nutrition outcomes. So according to relevant literature in other settings, they use a weighting criteria to estimate only the proportionate amount that can be attributed to an outcome to the nutrition outcome, right? So here in our proposed typology, we use the quadruple system according to the SUN guidance note. And in that system, all nutrition specific or the direct expenditures or direct nutrition intervention will be weighted 100%. And then for the nutrition sensitive shown in the slide are the specific weights for each program domain. Next slide, please. So of course, being the first or initial stages of this typology, it is not without limitation. So first, the complete classification levels described earlier may only be used if the financial document that we'll be referring to is or can be tagged up to the activity level expenditure. So here we refer to the program plan of each of the program managers of each agency, because if the expenditures are lumped per program, the tagging can only be done up to level 1 or level 2 program classification. So it's only up to the program domain. And then on select lump expenditures, which is, for example, cross-cutting expenses or support to subnational offices, there may be a program component misclassification and overlap. Thus, the program managers should be capacitated and should be able to choose and tag the expenditure according to the program component where it is best fit or most appropriate. Next slide. Okay, so in the paper, we shown sample tables. I think it's just not reflected in this version of the slide deck, but there we shown the sample tables that you can regularly generate if you have a systematic way of tracking nutrition investments. So this can also be made public and visualized in various manners, such as the dashboards, which can be easily accessible to program managers and policymakers and open to the public for scrutiny. So why am I saying this? It's because this presentation may be sort of methodological in this sense, but the use for this typology could be beneficial to our program managers because we can generate regularly statistics on how much are we spending for the threshold. So in the following slides, we will discuss now the proposed budget tagging process once it is institutionalized. So ideally, we envision the National Nutrition Council as the highest governing body in nutrition, as they should spearhead the establishment or institutionalization of this system. So next slide, please. Okay, so the first step, of course, is to prepare the financial data to be used in the nutrition budget tagging. So to provide activity level budget items, we expect that the work and financial plans or similar documents should be necessary. So using this level of disaggregation of line items in the WFPs, the disbursement data or the activity level expenditure should be traced accordingly. So this may be gathered from other relevant documents, but the program manager or the assigned staff of the relevant national government agency should be in charge in organizing and collating this document. Next, the accomplished NBT sheet should by the corresponding agency should be used by the program managers to tag these expenditures mentioned coming from the prepared financial data using the framework that we have described earlier, and a tool, an Excel tool at the simplest form, could be used for this purpose. So next slide, please. So the sheet I mentioned after tagging should be submitted and compiled and submitted to the National Nutrition Council for analysis of the tag expenditures and for the generation of the tables to be used and according to what the NNC will be envisioning, right? Okay, and then for the step 4, the results of the nutrition expenditure tracking analysis should be reported regularly for the decision makers and policy makers and the general public scrutiny. So ideally, we're looking at seeing this or these regular statistics in perhaps an online dashboard, which may be accessible at the probably NNC's website. Having easy access to these statistics on an annual expenditure for nutrition relevant activities will help them observe patterns in nutrition spending and critically assess if there are changes needed in the prioritized for nutrition investment. Next slide, please. So as you may have inferred, the tagging process is highly dependent on the assigned program managers of the relevant offices, as the first few steps of this process will be done by them. So they should be capacitated well on the objectives of the expenditure and the implementation processes of this exercise in order to achieve the desired outcomes. And due to unstandardized formats of financial documents from agencies, different difficulties may be encountered by agencies in compiling the financial data. Next slide. So moving forward, we only have 2 points here to consider in improving and advocating for the budget tagging in the future. So first, the typology or the framework is very dynamic. Thus, continuous improvement of this framework should be done through subsequent pilot testing and periodic refinements. And then the most important point is, of course, we should actively push for policies and issuances for the institutionalization of the system. So this is not just limited with the framework, the typology that we have described earlier, but the success of this system is highly dependent on the push and the capacity of our public financial system and the national agency, because in order to have that ideal system, we might need to revisit also how we report the financial documents, how or the standards on the documentation for this to be efficiently done regularly. Next slide. Okay, so that's it for this paper. It's very brief because it discusses more on the method, but this just describes how this nutrition expenditure should be tracked and reported to the public. Thank you so much.
Thank you very much, Val and Lyle. Those are two very interesting presentations, and we'll have more time later on to discuss important details in your manifestations. So I'll just remind our participants via Zoom and Facebook Live to please send in your questions via the chat box and the Q&A box of Zoom. Now, to enrich our discussion, let me introduce our esteemed discussants. Allow me to present to you our first discussant, Mr. Karl Jeffrey Sabalza. Mr. Sabalza is currently employed as Planning Officer 3 in the Early Childhood Care and Development Council. He handles planning, budget, legislation coordination, and NCDC conversion project. Karl graduated in Centro Escolar University with a degree in clinical psychology. He currently serves as planning officer and ECCD Development Council staff. So now may I call on Karl. Karl, please make your manifestations.
Yes, good morning, Sir Sunny. Morning to everyone. And first, in behalf of the ACCD Council, we'd like to commend the result of the very comprehensive study conducted by the PIDS, of course, through the Commission of EDCOM. We agree on most of the results or significant findings of the study. But I just would like to focus my discussion on the appropriate response of the council, particularly strategies on how to increase and ensure that the investment, both of the local and national, are properly and appropriately utilized. So we have three key strategies that will be presented also to the Education Commission later this afternoon. So I cannot present the entire strategy and investment plan yet, but I'll just take 3 points to the presentation, which I think will help our key stakeholders, both at local, national, and also other sectors. So these three strategies that we are looking at and will be proposing is first is increase advocacy in ECCD investment. And then we have the enabling policies and also how to improve and strengthen implementation of the existing policies and programs. So first, in the advocacy increase in investment, the ECCD Council is enhancing the implementation of our communication plan as aligned with the 2023 strategic plan of the ECCD program in the country. This is in partnership with the UNICEF. And then also in terms of a part of the findings of PIDS, in terms of the fragmented delivery of ECCD, both at the national and the local, it's very important to look into the specific component implementation of the integrated ECCD program, particularly on health, nutrition, early education, and other services. So part of the strategic action is to re-enroll the ECCD to the PCB, the Program Convergence Budget of the Department of Budget and Management, so that we can appropriately analyze where the budget will go, how the budget will be utilized, what sector should be responsible in providing PPAs. And then also part of the advocacy is to conduct a massive advocacy program, particularly to the local government units, engaging the leagues and the Union of Local Authorities of the Philippines, since the ECCD program, by virtue of RA 7160, is really devolved to the local government unit. So it's very important that our local government unit is responsive in terms of investing and providing comprehensive and appropriate programs, particularly for children below 5 years old and their families. And then as mentioned by Dr. Ulep, na part of the structure or governance in the country, we need to guide or provide assistance to our local government units in terms of planning and understanding how to invest in ECCD program as part of the mandate and responsibility of national government, particularly the ECCD Council and its member agencies. And then next, in enabling policies, we need to review existing policies that will improve program delivery, like in terms of ensuring the security of tenure of our child development workers and teachers who are primarily responsible for providing appropriate early stimulation activities and programs, as part of the result that approximately 50%, only 50% of the total population of children are receiving early stimulation program by their caregivers. So we need to enhance capacity and capability of our service providers on how to inform and guide parents in providing this early stimulation activities, particularly to the children below 3 years old who are not enrolled in a center-based program. So we need to take a look into the personal services limitation or cap in terms of providing appropriate salary or attractive salary or honoraria to our ECCD service providers. Also, as mandated by RA 10410, part of the, or apart from the local budget, there are other sources that they can utilize to fund and improve programs at the local level, such as the SEF, the Gender and Development Fund. So we need to review this and recommend on policy reforms on how to improve and mainstream ECCD programs to shares in these other funds in the local government unit. And also to increase revenue of local allocated for the special education fund. Currently, it's 1%, so we will be proposing an additional 3% to SEF coming from the real property tax of the local government at the local level. And then lastly, part of the strategy is yung improvement or strengthening of the implementation of existing policies and programs. We're planning to provide comprehensive capacity building programs to local government units, particularly the local chief executives and other implementers in planning and budgeting for ECCD program. And then enhance the implementation and improve coordination and collaboration, particularly to the DILG and Council for the Welfare of Children in the implementation of the child-friendly local governance audit, alongside with the seal of good local governance and presidential awards to serve as a carrot in rewarding or incentivizing good practices of the local government, particularly in providing quality integrated ECCD program in their own jurisdiction. And then also we want to utilize or tap into the Mandanas ruling as how they're going to increase in the national tax allotment provision on the salary or honoraria of service providers, particularly the workers and the teachers, particularly in those lower income classes, city and municipality from 4 to 6 class, and focus it on providing salaries and ensuring that we have programs, particularly in interventions for children with developmental delays and disability. And then we want to also adapt, as presented by Mr. Casas for nutrition. Same goes with the entire programming of ECCD. We want to have a budget tagging tool or system to see the length or up to what level is the investment of the country, both at the local and national, and also to see quality or appropriate spending of funds. So that's part of the key strategies that we're looking into. And then work with the Commission on Higher Education to better improve our institutions, academic institutions in advocating, providing professional development plan or professionalization of our ECCD service providers, both the workers and teachers nationwide, and exploring how we support the CHED and the ECCD Council, how we support local government in this area. And lastly, conduct periodic assessment and evaluation of major ECCD programs. And we really want to improve on the current programs that we are implementing, the projects. And just to mention, I don't know if 2 weeks ago, Dr. Ulep, we had a conversation on how the PIDS could help the ECCD Council in conducting further studies that we need to really focus or mainstream in terms of understanding what else do we need in the ECCD in the country that we can improve into. So I'll just focus on that, and any other questions, I'll still be staying as a representative of the ECCD Council. Thank you, Sir Sani.
Thank you very much, Karl. Okay, so please stay online for our open forum later on. I now go to our second discussion. We have Ms. Alice Nkoroi joining us from UNICEF Philippines as the nutrition manager. She joined UNICEF in October 2019, and she has over 20 years of experience in nutrition program design, implementation, management, and technical advisory across Africa and Asia. Alice brings a wealth of expertise to her role at UNICEF. Before her current position, she served as country manager for Ghana and Malawi under the USAID Food and Nutrition Technical Assistance Project, or FANTA. Alice holds a master's degree in medical science, human nutrition from the University of Glasgow, UK, and a bachelor's degree in food, nutrition, and dietetics from Kenyatta University, Kenya. Alice, please start your presentation.
Thank you. Thank you so much. I hope you can hear me clear.
Yes, loud and clear.
Thank you. And thank you so much to the presenters who have shared with us this morning about ECCD, as well as the nutrition budget and tagging tool. So for me this morning, I'll just focus on two main areas. I'll try to emphasize on some of the points around why the nutrition budget and tagging tool is an important, or basically the importance of nutrition resource tracking. And then I'll also highlight to you or emphasize some of the key areas we might need to work on in terms of moving forward. And finally, I'll share with you some of the role that UNICEF sees itself playing moving forward in terms of this budget and tagging tool or nutrition resource tracking. So in terms of, as we all know, and we've heard that nutrition or addressing malnutrition requires a multi-sectoral approach. There's evidence, a lot of evidence, and that is around the world. And what we have noted is that countries that have actually managed to reduce stunting, wasting, overweight, and obesity, or the triple burden of malnutrition, as we call it, then they have worked in a multi-sectoral nature. There are complex determinants of malnutrition. We know that they are interrelated, but we require different sectors to be able to address nutrition issues. And that in itself actually poses challenges for nutrition as a sector, because nutrition itself does not have a ministry in so many countries, but we do need different ministries and sectors to help us achieve our goals. Now, we know that the Philippines has actually made a lot of commitments towards nutrition. We know nutrition is a priority within the Philippine Development Plan. It falls under the strategy of 3.2, in ensuring food security and nutrition. And at the same time, the PPAN, or the Philippine Plan of Action, actually provides more detailed implementation framework in terms of achieving the overall country's development goals. So that is a very big commitment on its own. in terms of the Philippines moving forward. Now, we know despite all of those commitments, we do have challenges. And I think one of the major challenges is really around nutrition governance and financing. So how do we achieve these goals that we are, or how do we realize our commitment for us to be able to address malnutrition? And we see that there's a lack of routine monitoring of finances, to be more specific. So what we see is that there's no regular tracking of nutrition financing, and trying to pull out nutrition data, it's quite difficult. So there's limited quality or granular financing data in terms of nutrition. We do know there are so many sectors that, as I mentioned earlier, that are supposed to be delivering nutrition interventions, but it's very hard to know what is actually delivered. Is it high impact interventions? Is it going to contribute to our goals? So that is in itself is a challenge. Now, also the second issue is that we know the Philippines is highly decentralized, and nutrition spending is actually done at the local government unit. So we need to be able to see how do we track resources, or how do we track results and attached investments at the national level and also at the local level. Now, this nutrition budget tagging tool that was, or system that was presented this way, is a very, very good opportunity. And many countries have actually adopted the system. For example, Indonesia has taken on nutrition budget and tagging, and this has been helpful in terms of helping them to track resources. Now, in terms of nutrition budget tracking or nutrition resource tracking, it can help us to regularize comprehensive and reliable nutrition financing. So it will help us to be able to know where are our resources and where they're going to and how much are we investing. It will improve oversight in terms of support, oversight as well as help us in supporting cost correction and helping us to allocate resources in a more effective and efficient manner. And by tracking resources, I think I do not need to go through the presentation that was already made by Lao, but I think we would be able to track what we call nutrition specific, what is going to primarily within the health sector and in some cases within the agriculture sector, and what would be going to what we call nutrition sensitive interventions in other sectors. And at the same time, what we can see as enabling resources. Now, also, I think one important thing about the nutrition resource tracking is that it minimizes duplication. So because if we know where the resources are and what results they're achieving, then we will be able to minimize any potential duplication in terms of policy goals. The second area is that it will help us to be able to shift from what we call the ex post such as the public expenditure review, whereby we are going backwards retroactively to be able to assess what we are spending resources on. And this is what PIDS also together with UNICEF, we've done some public expenditure review, and it will shift us more to a more proactive planning and resource tracking and planning ahead of time in terms of where we want our resources to be directed. So just to emphasize, for us to have this in place, some of the key things that we might want to put in place within the government system is, number one, is a robust monitoring and evaluation system for the Philippine Plan of Action for Nutrition. So we do know that we have specific goals and targets that the Philippines is contributing to in terms of SDG 2.2, which is ending malnutrition in all its forms. However, we need a more granular M&E framework that actually helps us to know how we achieve these goals that the Philippines has committed to. That's the SDG Sustainable Development Goal 2. Now, aligned with this results framework, another important feature would be to cost comprehensively the Philippine Plan of Action for Nutrition. What I mean by that is that we know where we're going, and the activities we are able to attribute a cost to each of them on an annual basis, and also 5 on a 5-year basis or 6-year basis. And these resources are actually attached to a result. So just having a very robust monitoring and evaluation system alongside a comprehensive costing. Now, this is going to be very critical when it comes to planning. So if you have a long-term costing, then it helps you in terms of planning what you do or what is needed by what sector on an annual basis. Now, the third thing is around institutionalizing nutrition resource tracking. So I couldn't overemphasize. I know this was mentioned already by our presenters, but I think it would be crucial once we have these two things in place in terms of putting in place or the nutrition resource tracking. And this would help us on two areas. You know, the Philippines has adopted the program convergence budgeting. It will help us in terms of planning and tracking or monitoring and evaluation of the zero hunger program convergent budgeting processes, as well as the early childhood development program convergence budgeting process. Now, for us to institutionalize nutrition resource tracking, we will need the commitment or a resolution, for example, from the National Nutrition Council, and more so in particular, the DBM also kind of taking that stand and within who is a member anyway of NNC governing board. And this being a core practice on a quarterly basis, on an annual basis, being able to track resources, and then you're monitoring on a quarterly basis or regularly reporting in terms of what the results are telling us. In addition, the next will be ensuring, and I think this was also mentioned, that enhancing the budget classification so that it is aligned with the nutrition specific, nutrition sensitive programming and enabling programs, which also kind of speak to the PPAN as well as the PDP. So if we are going to institutionalize the tracking, then we need to align even the budget classification to this kind of classes so that it's easier for us to track. Third is consulting with the core stakeholders. And I think the presenter also highlighted that there are several stakeholders, key stakeholders, where we expect nutrition interventions to be delivered through. So there is a need to consult with these stakeholders and also get a clarity in terms of how do they contribute to the results. I know sometimes we might be tagging nutrition interventions as a nutrition intervention, but is this intervention going to actually contribute to reducing malnutrition? So I think that's a conversation we need to have in terms of what is impactful nutrition intervention versus what is an intervention that will actually not give us the goals that we're looking for. And finally, of course, there'll be a need for capacity building once we all have a common understanding on what we are tracking and what results we are looking for, what investments we want to put in, is capacity building of the core agencies and personnel who would be working in terms of realizing the tracking approach. Now, finally, I think what's very important, the nutrition budget and tagging, I think I'm using generally nutrition resource tracking because we need to look at resource tracking at the national level and at sub-national level. So the current nutrition tagging tool is really proposed for national level government agencies. But what do we do at the sub-national level? I think we need to look at how we align national resource tracking with sub-national resource tracking. And UNICEF at the moment is actually working with the CWC in terms of developing a nutrition budget tagging for children, which includes all interventions or basically all programming or results for children, and nutrition is one of the components. But what's important is we need to align these two. We need to align the classification. We need to align what we want, the investments with the national nutrition budget tagging, which is aligned with the PPAN, to the local nutrition action plans and local tracking of resources. Now, in terms of UNICEF's role in this moving forward, in our country program or in the UNICEF country program for children, which runs from 2024 to 2028, is fully aligned with the PPAN and the PDP. One of the core priority or strategic shifts, as we are calling it, is public finance management for children. So we have put this a lot of emphasis, a priority, recognizing that the Philippines is a middle income country that is moving towards upper middle income status, and it is critical that in terms of public resources are an important part of realizing results for children. So for us, it's a core priority, and we continue to work with different government agencies. Recently, we just had a consultation with multiple government agencies for us to identify priorities and come up with a roadmap for strengthening nutrition financing as part of the broader nutrition public finance management for children. Now, some of the key areas that we see ourselves engaging over the next 5 years is support with government agencies in application of the nutrition budget or resource tracking, and also strengthening the PCB or program convergence budgeting for zero hunger and ECD. Second is also working with NNC in terms of getting a comprehensive costing. As I mentioned earlier, this is an important aspect for us to be able to track our resources and alignment with the results framework. Third is around support, strengthening planning, monitoring and evaluation for PFM specific to nutrition. Again, as I mentioned, we have a broader PFM strategy, but we are looking at also how do we strengthen nutrition as its own sector. And also working very closely in terms of child budget tagging that is led by CWC, and seeing how there's harmonization of nutrition resource tracking at national and sub-national level. And I think what we propose from our side is that we realize this is a lot, it's a huge investment. So there might be a need to start small and gradually expand countrywide. So UNICEF as well is keen to support, work with relevant government agencies in terms of piloting the use of these resource tracking tools at a small scale, and also supporting the scaling up to other countrywide, basically. So I'll end there. Thank you so much for listening to me. Thank you.
Thank you very much, Alice. Please stay online for our open forum. Okay, the same request goes to our other presenters. Val, Lyle, Karl, please open your webcams so that we can start our open discussion. So apparently, our concerns are quite extensive in terms of nutrition-related problems. And you've identified problems with our reproductive stage adolescents, those who are going to be eventually mothers, our children, both from infancy, toddler stage, to eventually them joining our schooling institutions. And then concerns about services related to not only the presented information system or budget tagging, but also in terms of providing nutrition-related services to our mothers, to our children, to infants, and of course prenatal and prenatal services for our soon-to-be mothers. So before I ask specific questions, may I request Val and Lyle, please respond to the manifestations of our discussants. Val, can you start?
Thank you, Sir Karl, for that. No, I think we had a lot of discussion with ECCD and on how we can work together with, work together as government institutions. No, I think ECCD has a lot of plans and a lot of plans when it comes to early education. I think it boils down to, number one, is how the government really is serious in improving our multi-sectoral institutions like ECCD. And this includes sustained budget for them, making sure that there's enough human resources to to implement these expectations, because as I've said in our report, that there is really high expectation of them, but at the same time it's not, I mean, the expectation, it doesn't commensurate with the resources that they provide, the government, the country provides, right? For us to really implement these important plans and services towards early education, I think we need to make that investment, right? And I think we need to support ECCD Council on this front, no? And I think it's important that I want to mention this, no, that PIDS is ready to help in terms of providing the evaluation of these programs by ECCD Council. And I think that's part of our mandate and one of our core agenda when it comes to our core agenda in PIDS. So I think we are excited for that collaboration. So, but yeah, so I think that's the only thing I can say. It's really in strengthening our institutions, implementing, monitoring, and evaluating these important services. So yeah, it's strengthening our institution. So I hope we don't forget that. So yeah.
Thank you, Val. Lyle.
Okay, so thank you so much, Ms. Alice and Sir Karl, for those insights and manifestations. So because Adokval already emphasized the ECCD part, I'll just say something on the NBT for Ms. Alice. So first, we are very grateful for our partnership and collaboration with UNICEF and NNC on this work. So and we acknowledge that of course we still have a lot of work to do for this NBT to be pushed for and advocated for. But I'd just like to acknowledge that UNICEF and NNC has been working tirelessly for this to be actively advocated for. We are being invited in several high-level multi-sectoral meetings discussing this work. And as mentioned by Ms. Alice earlier, in future iterations and work needed for this framework to be improved further and aligned with the national and local level, PIDS is, as mentioned by Doc Val, also ready to be helped and be tapped in further work for this. That is for now, Sir Sonny.
Okay, thanks, Lyle. Yeah, well, just looking at this proposed expenditure tagging in government, it's not really new because, for example, for climate change related interventions or spending in government, we've had a long-standing arrangement with DBM, the ILG, CCC. So probably the same concerns that we've had there applies as well to this proposed expenditure tagging, and particularly a major concern that we have seen for the tagging arrangement is the weak link in terms of our subnational partners, particularly the LGUs. I think Alice also flagged this concern, and she actually mentioned that probably right now the tagging taxonomy probably is more suited at the national level. Alice, can you elaborate more on that?
Yes, and thank you that you share about the experience we already have with climate. Yes, at the moment, maybe just to emphasize, the tagging at the moment is for national government agencies. I believe that's the discussion we've been having with the technical colleagues at PIDS. But what we are also doing is to coordinate with CWC, who is developing the budget tagging for children for subnational level. And UNICEF is also supporting CWC as the lead in DILG. What we've been discussing is to see how we can make sure that the taxonomy that's used for the national level is aligned with the local level. And I think we are moving in the right direction right now. It's just a matter of updating the subnational tool, and then the next step will be to test it in a couple of LGUs to see whether it's applicable. But I think for us to comprehensively know the nutrition resources available or being utilized in investments, then we need to have both angles, national and sub-national level. Thank you.
Thank you, Alice, for that answer. So we have clarified this is it's well initially for a national level grounding. I think Karl delved more on LGUs being capacitated to eventually probably accept something like this as a platform. And I think, given the presentation earlier by Val and Lyle, the weakest link that we see is at the subnational level in terms of nutrition-related performance or outcomes. There are, well, a lot of disparities between the more endowed geographic locations compared to the poorer ones. And looking at families, as also presented earlier, we have the less endowed families, the poorer families having lesser performances in terms of these nutrition-related indicators, not only in terms of malnutrition, stunting, but also in terms of learning-related indicators. So those are big items that we need to address. Karl, can you elaborate more on your earlier manifestations about that big role of our local government unit and eventually ECCD's place in everything?
Yes, thank you, Sir Sani. Actually, it's very, thank you for pointing that out. It's very important to take note that the biggest responsibility actually in addressing these concerns, not just on early education, early development, but as well as the concerns, particularly in nutrition. Nutrition is very important component to be able to address problems in early development. It's a key component in addressing all of these concerns in improving our development and education. The local government should really respond appropriately in terms of improving program delivery, because that's the government structure that we have. A lot of the basic programs are devolved at the local level. So it's good to understand how we improve budget allocation and also mainstreaming important PPAs or projects, programs and activities that will really suit different contexts. It's also important. Actually, I took note of that as a recommendation to PIDS to have a more, I think, granular data in terms of concentration of different problems or concerns of different LGUs. Like, I think Dr. Ulep or I don't know if it's FNRI who had presented concentration of most of the concerns in nutrition at the Bangsamoro autonomous region area. So we need that data so the national can respond appropriately depending on different contexts. Since we're dealing with a lot of different LGUs with different economic capacity or capability, also different leadership dynamism. It's also important to take note of that most of the programs, particularly in ECCD, are how do I describe this, is somewhat reliant to the prioritization of local chief executives. Even though we have a very good program at the national level, and if this is not part of the priority program of the local chief executives, it will not be automatically implemented. That's why we really need to have a good advocacy in terms of engaging our local government units, particularly the local chief executives, in highlighting and mainstreaming these important programs of the ECCD, particularly the nutrition the health and nutrition program, because this is one of the most I think important issues that we need to address.
Yeah.
Thank you, Sir Sani.
Thank you, Carl. Yeah, I think the big role of our local chief executives is really a very big concern, not only in terms of nutrition-related interventions, but all the others. Whatever is the priority of our LCE is the one that is translated in terms of their annual budget allocations. And that is true for all the major interventions, may it be nutrition-related, disaster-related, resiliency-related, or even all the other investments by the LGU.
So
you also, okay. Right, Val, you want to say something?
Yeah. So I just want to respond to that, and that's a very good point. Like, I think this is not a problem only in the Philippines, but you observe that in many decentralized regimes, right? That variation in priorities, and that will lead to variation in outcomes. It's a manifestation of a very decentralized regime, right? But I think that's part of our recommendation to really use your national resources to leverage local government to spend more and to do the activities that the national government desires, right? But what we are seeing in our analysis, and that's also true for other documents that we've written, is that most of our national resources towards local governments are very, I will call it very passive, right? So it doesn't really shape local government to spend more on health, spend more on primary healthcare, spend more on nutrition. But in fact, when you provide them resources, the resources also declines, right? I mean, their spending also declines, right? So we had a study on that for primary healthcare. When the national government increases, your PHC spending at the local level declines, right? So your national resources are very passive. So how can we make it more, I would say, active, so that local governments could really take the proactive role and they do the things that the national government desires or think should be the direction when it comes to nutrition and health, right? So I think that, yeah, it's a thing that we need to discuss on how we have that level of interaction between national and local, especially now that there is Mandana's ruling, right? The national resources will decline in theory, then the local government will increase. So how will you gonna use that meager national resources to shape local government spending, or local government programs and activities, right? So I think that's one of our second recommendation, is to leverage your national resources, right? For local government to spend more on nutrition or primary healthcare. But yeah, so I think that's just my take on how to operationalize that when it comes to, I mean, in a highly decentralized regime, with high variation in performance. So yeah, I think that's just my take on how we gonna solve that.
And
it's easier than
that is thank you, Val, for that answer. And I think that is easier said than done.
Exactly.
Leveraging
but yeah,
even national government resource and influence, really, in terms of us influencing local government spending and resource allocation. That's how we want to go forward in most of our national level programs being cascaded to our LGUs subnationally. But yeah, as mentioned earlier, also by Karl, well, we have a lot of complexities. So I'm going back to the typology of what we want to see in terms of our supposed systems. Lyle mentioned a lot in terms of nutrition specific and nutrition sensitive items that we need to keep tab on, and they are so many. So probably implementing something like this is not only complex but also very tasking at the national level. What more if we go subnationally? I think Karl also mentioned earlier that concern about us having more granular data, maybe on nutrition-related outcomes and then nutrition-related spending by government. So, Lyle, can you say some more about the typology of our supposed spending monitoring? And I think in the typology, it's also cross-cutting in terms of sectors involved. So you have there agriculture as well being looked at in terms of nutrition-related inputs. So, Lyle, please.
Okay, thanks for that, Sir Sonny. And indeed, I agree. The list or the classification domains are really exhaustive in nature because these interventions are the identified effective maternal and nutrition interventions as well in the global literature. And in the Philippine setting, in PPAN, our National Strategic Plan for Nutrition, these are the identified interventions that each national government agency in the in the multi-sectoral landscape should be contributing, right? So as we've seen in the list, it's not only limited to the health sector. It really involves other agencies outside the health sector because this conforms to the uh, framework in addressing the maternal and child nutrition. So it looks very complex and a lot to tag, but because it is pre-identified on which agencies are accountable on these specific programs, it should be inherent in that system that they would regularly focus on these agencies that are expected to deliver interventions falling under these domains and which aligns on their mandate. And in the local level, these are the usual maternal and nutrition programs and even the non-health programs that are being cascaded. And when the time comes that we can already institutionalize this system and we can already apply this in the local level, hopefully, if once our program managers are capacitated, we can regularly do this efficiently.
Thank you, Lyle. So I guess knowing really is a big part of us winning this battle or this war with nutrition-related problems. And I think we can probably transition to that. It's a more grounded exchange. Us flagging right now nutrition-related concerns because there are a lot, not only in terms of nutrition-related outcomes, but also in terms of learning outcomes. And we are looking at eventually these young, these children eventually joining the labor force. You're looking at a potential bomb. If I'm going back to an earlier engagement by PIDS, they've actually mentioned the possibility of a big explosion, a bomb exploding eventually, with us not benefiting from a supposed demographic dividend, but us being faced with a lot more problems because of compromised development among our youth. Alice, you want to manifest something?
Yes, thank you. Yes, I just wanted to add to what Lara has already mentioned, emphasizing that a lot of these interventions, they might look complex, but they actually exist. And some of them are being done already, but unfortunately, they're not reported in a finance way. So we don't know how much money is going to this intervention, even if for example, the health sector is doing micronutrient supplementation. They're doing a lot of things, but we don't know how much money is allocated to that particular intervention. Is it enough to actually reach all the children? So maybe what could happen is probably more granular data in terms of the investments and the results. Now, when it comes to what we are saying, nutrition sensitive, I think the agency we've identified, they do say they're doing some nutrition sensitive interventions. So they are doing some work. But the question is this an impactful intervention or not? So I think what the tool does and what the framework does, it helps to clarify what is actually, if it's the agriculture sector, what is the most impactful intervention that you can do? Yes, you're doing nutrition intervention, but what will actually help us to achieve the nutrition results? Likewise with education, likewise with social protection. What are the core? So it helps to level off and clarify, but every agency is doing something on nutrition, really. But it's really where should we channel our resources? Thank you.
Thanks, Alice. And yeah, going more into that, all our major departments have their own tagging mechanisms. May it be in terms of their own spending or even the performance of the stakeholders within their respective sectors. So you mentioned earlier the existence of all of these, and we just need to put structure to everything, and then eventually have that system in place for a more convenient, readily accessible source of knowledge or information. You want to say something, Bang? Yeah,
this
please.
is more like the governance structure again of this budget tagging, right? We have the National Nutrition Council, which is a multi-sectoral body, right? So if we're gonna implement the budget tagging across national governments, right? Across national governments, DSWD will do it, DOH will do it, PhilHealth will do it, DepEd will do it. I think what is the question now is how to operationalize this, and what is the role of the National Nutrition Council to implement this, do this on a regular basis. And as far as I understand, this is actually one of their core function as a council, is to see whether these institutions or national agencies are actually providing or spending on these resources, right? So my take on this is actually a very, very good tool for the National Nutrition Council and multi-sectoral agencies to examine how these national agencies are doing or contributing to that multi-sectoral goal or agenda. So again, it boils down to the capacity of these multi-sectoral units to use these tools, right? So yeah, so I keep going down to the institutions because I think at the end of the day, I agree with Alice that one of the main thing that we haven't really talked about in nutrition and health is the value of the strong and robustness of the institutions, right? And yes, I just want to segue this budget tagging and its possible role for or as a possible tool for National Nutrition Council, which is the main body mandated by the law to check the nutrition in a multi-sectoral lens, right? So I don't know if I'm making sense, Alice, but that's just my take. I'm trying to inject that this a very important piece of work on nutrition budget tagging and how can we incorporate this in our current institution, right? And maybe that's also true for ECCD Council. How can they use this to see or to track how other institutions are doing, given that they are also multi-sectoral in nature, right? Then they can actually push for accountabilities for these for national agencies. See, we are not spending a lot on this. We're not spending on cost-effective intervention, and you can say that to the national agencies, right? Through that budget tagging, right? I don't know if I'm making sense, but that's just my take on how to kind of, look into these institutions in implementing nutrition programs in a multi-sectoral lens.
Thanks, Val. Yeah, you pointed out probably the current focus in terms of these institutions looking at nutrition-related outcomes, indicators, not only among our target age group, probably across age groups and across sectors. That's probably what we have right now in terms of the literature. And you're right, we should relate government spending to these manifested outcomes. Probably another question would be, well, we need this convergence, we need this interface between us looking at resources being allocated to nutrition-related interventions, and then eventually looking at nutrition-related outcomes. Probably a question right now is are we doing enough in terms of looking at these indicators of nutrition-related outcomes? Because eventually we'll be assessing the impact of something like this expenditure tagging to the eventual indicators that are being manifested. Who wants to answer? ECCD, probably, Karl. Are we doing enough in terms of us keeping tab on nutrition-related outcomes within our target population? Or do we need more? You want to say something, Karl?
Yes. Actually, that's what we're really looking into. Really identifying or surfacing this specific concerns in terms of investment. So where do we need to invest this much, or are we really investing that much? So that's probably one of the as mentioned by Dr. Ulep, one of the objective or purpose of really tagging this budget expenditure. But again, for ECCD particularly, not just the tagging of the national spending, but also local spending. Though yes, it's very complex to have that tagging on different levels. But currently, what we're pushing is to have that cost sharing of investment percentage from the national, and then yung big bulk of it should be the local. But we need to understand how the local will do that, how the local government will identify appropriate sum of investment or money to be able to address and provide the need for improving basic needs for children, particularly those belonging to below 5 years old. So I think Dr. Ulep, this is the what I'm thinking, pero I will still propose this with the principal of the ECCD Council, the governing board. What we can collaborate with PIDS, if PIDS also will have a proposal on this plan in terms of having that appropriate plan for investment both at the local and national, particularly the local government, how we influence it. I agree that the responsibility of the national is to influence the increase of local spending, particularly on this program. So
not substituted.
Yeah.
And probably that's also a big question, given, as you mentioned earlier, the Mandanas ruling. I think Karl has been very consistent in terms of him saying that the LGUs have the bigger role in grounding interventions related to this. And going back a decade ago, we went around the provinces looking at school-based management and school-based feeding arrangements. And I think back then it wasn't only DepEd, but was the LGUs as well, chipping in terms of funding all of these children-related interventions at the subnational level. So LGUs really play a very big part in terms of not only grounding nutrition-related interventions, but also probably them monitoring. Because back then, the school-based feeding arrangements actually were avenues for them to keep track of nutrition-related outcomes among children. So I don't know if it's still the same right now, if they have a more structured way of getting enough information or data among our supposed target population. Is it better right now compared to a decade ago? Would you have any assessment, may it be personal or professional, related to this? Are we better right now compared to a decade ago in terms of keeping tab of nutrition-related outcomes subnationally? Karl, you
yeah.
unmuted. Yeah.
Mm-hmm. Actually, even up to now, we're still not really that how do I say this? Good in, in data gathering, particularly because as reported by the NNC, the data that they have is at the, if I can recall it correctly, at the regional level. But as to data coming from the local, particularly at the barangay level, they're having difficulties collating those data. Even with our meeting with the core group for the child-friendly local governance, this DOH and NNC are really having concerns in terms of gathering data, comparing it from the national and then the local data. Even in the ECCD Council, we're in improving the system for collecting data on children in terms of different services and also population data. But we're collaborating in terms of population data. We're collaborating with the PSA. But as to specific statistics, there we're trying to improve on the data. Comparing it to before, I don't know if there's really a significant improvement on gathering data, personally. Because if we have that comprehensive data, it's much easier for us to really appropriate and identify programs.
And eventually attribute the impacts of spending on those outcomes.
And I think that's one of the responsibility of the national agency to really look into all these informations that we need to understand through data gathering.
I think I go back to Alice and Lyle. Alice manifested earlier that this proposed tagging arrangement will create that shift from a basically ex-post approach to a more proactive approach in government. My big question is, aren't we doing this right now? A proactive approach to everything, and that includes nutrition-related intervention. Alice, please.
Yes, so maybe let me clarify what I meant. Yes, it will shift, having a nutrition budget tagging tool will shift from the ex post in the sense that we are going back retroactively to look at historical data. If we want to understand how much did we spend for nutrition, we would have to do a public expenditure review. But by shifting to nutrition budget tagging and tracking, then it means that we would be able to do what they call the ex ante, that we actually do have data. We can go back to our data from the tool or from the resource tracking and be able to track whether it's in terms of having policy briefs or having a dashboard. I think Lyle mentioned that, which gives us realistically what is being spent for what. So that's what I meant. Right now we have to go historically, and the data quality is not good. I think we mentioned that there's no granular data, so it becomes so difficult. I do know that Lyle and Val have done the public expenditure review, and they will give, that's I think another discussion, how difficult it can be to actually know what was spent for nutrition or not. Maybe just to go back to your previous questions, I wanted to react, but I just wanted to highlight, I think one challenge we have at the moment is the fact that when we do program reviews, we are doing a programmatic review in terms of how are we achieving in terms of nutrition indicators, or when surveys are done, we are looking at that data, or we are looking at our growth monitoring OPT data. Of course, it has its issues here and there, but we do it aside from the investment. So we do a program review, an evaluation of the program data, but we don't evaluate the investment. These two should go hand in hand. So you're evaluating your programmatic aspect and alongside your investment, so that the face of nutrition is changing right now in the Philippines. If you look at the last 10 years, you will see there's a change. Overweight obesity is increasing. Stunting is reducing gradually, although not as well as we would say. Wasting has reduced. but are our investments working hand in hand with where we see more need? I think that's a question because we are not reviewing the two together. We don't have data for expenses. We have more readily available data on the programmatic aspect, but not the financial data. So I think we need to bring these two together somehow. And I think the two can actually help us to be able to look at the two hand in hand.
You're bringing up Alice. All right,
Sorry,
thank you.
should I
Thank you, Alice. Thank you. Lyle, would you like to add something to that?
Yes, I mean, just to re-echo what Ms. Alice was saying earlier. So, yes, we have done the public expenditure review before this NBT, and really, it's very challenging if we have these systems in place. Because just to like briefly describe that process, we had to manually check each item in every financial document and tag those expenditure according to uh the classification framework. So if this proposed framework would be eventually improved and institutionalized, then it will be easier to just regularly run through the data and then come up with the numbers that we need. But if we do not have this, then every time or annually or whenever we'll do the review, we'll have to manually do it again. And it's not a very efficient process. That's why we're hoping that when this system gets institutionalized, at the very least, we'll have that regular number on how much are we spending, which would inform our decisions. That's the insight of Sir Sami.
Thank you, Lyle. Probably one last question. I've been seeing concerns, for example, in terms of standards and policies being grounded. For example, it was mentioned earlier that just 35% of our children are benefited by our daycare facilities. But this is already within the standard of ECCD. Another number is 89% of municipalities meet DCC CDC requirements per RA 6972. Are these entry points for better policy? May it be a legislation at the national level or functional policies within our departments. Okay, Karl, and then Val.
Yeah. Actually, right now, there are two proposed bills, both at the House and Senate, to really improve the national policy in terms of ensuring that all our local government units, particularly the barangays, are implementing ECCD program. But it's also important to take note that speaking of centers or providing center-based program, it's not just the avenue for providing ECCD programs. We also need to understand that it's not just account of the existence of center-based or the early daycare centers that we want to check, but also are there any other modalities like having the home-based programs or supervised neighborhood play programs? Because this also addresses the needs, particularly in providing early stimulation and opportunity for children for their play and development. So the national government, aside from ensuring that we are providing legislations for the local government to adopt and implement, the national government is also responsible in providing policies and guidelines in understanding what appropriate programs and interventions that we need to provide in terms of understanding economy, geography, and other factors that we need to also understand to better suit the needs, particularly in program delivery of integrated ECCD program. So that's what we're doing right now.
Thank you, Karl. Probably I'll ask a different question to Val. Our last question before we go into our closing statement. While being the lead investigator in these studies, you've seen large disparities across geographic locations, across sub-regions, regions, provinces, municipalities, and across socioeconomic classes. So probably that, well, those concerns present so many challenges, but as somebody who's been looking at this at, I think, a very good vantage point, what can you suggest in a very brief response? How do we really go forward and make everything much, much better? Well, please.
I think the simple answer to that, I mean, as you've said, it might be hard to implement, but I think the government needs to do this. Is number one is to make sure that we use the national resources to leverage local government spending. Second is a lot of our national programs in health, nutrition, I'm not sure about education, but a lot of them are highly inequitable, meaning that we've done a lot of assessments. And if you look at where did national government resources go, is actually not the poorest local government in this country. So to answer your question is, how do we make our national resources more equitable? We should invest more on areas that needs the most, right? But we're not doing that in a lot of our health and nutrition intervention to reduce that disparity. And second is, how do we use that national resources to leverage government resource, local government resources? In a highly decentralized regime, that's the only thing that we can do at this point, right? Those two important ways of dealing with local governments. So yeah, I don't know if I'm making sense, but that's how I see it, and that's, we are very consistent with our recommendations on how to use the national resources and how to allocate them more equitably through local governments.
All right. Thank you, Val, for that good answer to a very complex question. Now, I think we have plenty more to ask you guys. Unfortunately, we've run out of time. And we are now into our closing statements. May I request Karl, please, for your final thoughts before we close. Karl.
Yeah, actually, it's not that long. There's really a need to really improve our programming, particularly at the national level, so that we may impact the implementation at the local level. So really the responsibility to empower the local government should be on the national agencies. And yes, as mentioned, that there's really a challenge in governance, particularly if we are in a multi-sectoral way of governing, particularly the ECCD program. So we need to go beyond those difficulties and challenges. And I think the recommendations by the PIDS should really be of importance, particularly to the national government. And again, there are some recommendations also, not just by the ECCD Council, but also the Education Commission, who are really focusing on these programs that we need to work on. So good luck to to us.
All of us.
But also we really need to work together to really improve our programs, particularly in improving our human capital development, because that's really our main objective here, particularly the ECCD Council, because we are the gateway for this improvement of our human capital. So
all right.
Thank
you. So
you.
that's the goal, Karl. Thank you.
Yeah.
Lyle, please, for your closing statements.
Thank you, Sir Sani. So Mine will be just very brief. So cliche as it may be, we've come this far in efforts to improve the budget tagging systems, but we still have a lot of work to do. So however, I'm optimistic that given the institutions involved in the currently ongoing efforts, we'll reach the point where we can regularly do this. And I envision or look forward to the day that these numbers, critical in making decisions, will be easily accessible. And then on a broader scale, we hope that these systems level interventions or recommendations will transform the country's nutrition landscape, helping to ensure that no child suffers from stunting or wasting, and that each can reach their full potential and productivity throughout life. Thank you.
Thank you, Lyle. Alice, please.
Yeah, no, I think from my side, I think it's really to look at institutionalizing the nutrition budget and tagging tool. We, from our side as UNICEF, we see it's a very important step towards realizing or addressing all forms of malnutrition. And giving NNC, the National Nutrition Council, that that support that it needs to be able to regularly monitor and utilize this nutrition budget tagging for resource tracking at national, and then also working very closely with DLG and the local government units to also institutionalize the local level resource tracking. And finally, I think from my side, we need to move forward to looking at how we connect programmatic monitoring with financial investments and also monitoring finances. So looking at the two as contributing to one another rather than looking at them as two separate entities. And I believe that with the nutrition resource tracking tool in place, it will help us to be able to converge to have the programmatic results monitoring alongside the financial results monitoring for achieving the goals that we want to achieve. Yeah, thank you. Over from my side.
Thank you, Alice. And Val, final statements.
Okay, so thank you very much again for giving us this platform to present the work. Thank you, Sir Karl, Miss Alice. They are our partners, our regular partners. But I think our commitment at PIDS is to really institutionalize or develop mechanisms to improve governance and accountability. And one of that is the budget tagging. We've been doing a lot, maybe outside of this work, but for instance, we are helping the DOH to develop the national allocation framework, which has been adopted by the department to better allocate national resources and not to spread it indiscriminately, given the meager resources. But all these efforts are really a mechanism to increase efficiency, to make sure that it reduces inequities in local government performance. And this budget tagging is also a part of that bigger narrative and desire to have a more institutionalized planning allocation, right? Because a lot of our studies will show that huge disparity could be a function of indiscriminate misallocation of resources, right? So, and I hope these tools that we are currently working on at PIDS will somehow help with that aspect, right? So, and again, thank you very much. Again, Sir Karl, Miss Alice, for long history of partnership. So thank you. Thank you, Sunny, for giving us this platform to present our work. Thank you.
Well, thank you. Thank you, Val. I think we need more seminars on health-related studies. So we should schedule more of this kind of exchanges.
Thank you.
And with those manifestations, let's give our presenters and discussants a very big round of applause. Okay, so before we officially close our program this morning, let me announce our raffle winners. So we've chosen 2 winners from Zoom and 1 winner from Facebook. So from Zoom, our lucky participants are Gail Porter, Laurel from EdCom 2, and Akram Latif from Mindanao State University. And from Facebook, we have Jik Akupan from Malungon Youth Movement. So congratulations to our raffle winners. You may collect your prizes from our technical staff. We'll be in contact for you to get your prizes. So once again, thank you very much for attending our webinar this morning, and we look forward to again having you guys with us in our future engagements. Before we close, November we'll be having another international event with Jeff of Japan, and that will be in the last week of November. So meanwhile, if you are interested, you can download the presentations from our resource speakers from our website. So we are going to post the link in our social media platform. So go there and get your copies of the presentation materials. And the same, this video will be also posted in our social media platforms. So please help us improve our events by answering our feedback form. Also through the links provided via Zoom and via Facebook. So please note that an e-certificate of participation will be automatically generated once you submit your completed feedback forms. So we are awaiting your feedback on this morning's event. Keep in touch with us. You may follow us through our platforms on Facebook, Twitter or X, and YouTube channels. Now we have as well a LinkedIn account and eventually a TikTok account. So with those, thank you very much. And let us all have a great remaining day ahead.
Thank you and bye-bye.
Thank you, Alice.
Recording stopped.